This network is named Hudson Headwaters for a reason, and that is the wild rivers of the Upper Hudson, which is an amazing stretch of country. In 1974, when it suddenly seemed a whole generation of physicians were about to retire and decamp, how do you leave? There was the prospect of an absolute medical vacuum, no one here to take care of people. And it was a matter of putting one foot in front of the other, and now we have a network.
My primary view of Hudson Headwaters is that it is a critical primary healthcare provider in a rural part of the state, most notably the Adirondack Mountains. A large part of our business is rurally located. A great number of our employees are rurally located within the Adirondack Park. Primary health care and critical health care is absolutely a necessity for their well-being, and the well-being of our employees is a critical necessity to the well-being of our organization. Hudson Headwaters provides services to this beautiful region where others have just decided to leave because they can't make ends meet. We see our relationship with Hudson Headwaters as an absolute partnership, not only for the well-being of our organization, but the well-being of society as a whole in the area where we live and work and play.
We take a lot of pride in the fact that we take care of everyone. We take care of people who have plenty of coverage, but also people who have very limited means, no health insurance, and depend upon caregivers who are available in ways that are unusual but very, very important.
I went about 15 years without health insurance, and the North Country ministry kept saying, "You've got to go." I don't have any money, I can't pay for it. They frog marched me over to the health center and told Hudson Headwaters, "We want someone to help this person. She needs assistance." They started from somebody who was a mess, and Dr. Rajewski systematically ran me through every test and procedure under the sun, and she cleared up an awful lot of the problems. So I got on the sliding fee scale that they have at Hudson Headwaters, and they respected me as an artist, and they tried to see how I do my artwork, to see how they could help me, knowing that if I couldn't have gone down to the health center and used the services Hudson Headwaters provides, there are 2 cemeteries further down the street, and I would have been probably in the Catholic side. And money does not define everything, even though they say it's the bottom line everywhere. It's an exception made here.
Hudson Headwaters has 12 health centers. We take care of 60,000 different people in the course of a year, 250,000 patient encounters. Our patients love us, and we think we deserve it.
Hudson Headwaters has been a great provider for our family, for care for our children and for ourselves. They've been able to get us in always for appointments, which is so important, especially when you have sick children that you're concerned about. We're able to call up, get right in for appointments. We're able to call with concerns, and our messages get relayed to our doctor, and we always get a call back, so it's very comforting for the great care that they provide. The physicians at Hudson Headwaters have been outstanding with the level of care. We've had many times where we've had pretty serious illnesses with the kids, and our doctor has always completely told us, feel free to call. Don't be afraid to call us. We are here for you. So I have no hesitation in calling, and they always call back. We can get in to be seen. Even in the middle of the night, Dr. Sokoloff has told us, feel free to call me. You're not a number. I know that he feels that way, that we're very valued, and I feel like our children are just so well cared for. You don't get that wonderful care at very many places like we do with Hudson Headwaters.
We practice in communities where if we weren't there, we know these people would have no care. So the opportunity to serve people who need the services, and then of course come right around and appreciate us in a real old-fashioned way.
I came to know about Hudson Headwaters in probably the worst way possible. We were up here, as usual, looking for a summer of fun, and I got sick.
By the time the second day came around, he was really sick. I knew we had to go somewhere and get help and couldn't go home. And like probably many other summer people, we don't think about health and that we might get sick. So we went to North Creek Health Center. And it was Dr. Sawyer there who recognized right away that he was very ill, and he sent him by ambulance down to Glens Falls Hospital.
At Glens Falls, I was there for a day. I went into a coma. I was in a coma for 8 days.
My initial reaction when Bill was sick was, we've got to get him to Long Island, we've got to get him to New York. He's got to get to the doctors down there. After 1 minute with Dr. Rugge, it was, no, we stay right here.
I can't tell you how much I appreciate the fact that Hudson Headwaters doctors were here to care for me. No question about it, they saved my life.
We call Hudson Headwaters by its national name a community health center. That means we serve the community, but in equal measure, it's the community that serves us. And it means being not-for-profit. It means having a board of directors of local people who watch over us. It means qualifying for grants and looking for opportunities to serve that simply aren't available any other way. Everyone here knows that this is a special place, and there's a special opportunity to make a difference.